Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on December 11, 2020, and is scheduled to run from 10 a.m. until 11 a.m. I want to thank you for taking some time to join us this morning. My name is Steve Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. As we mentioned last week, this will be our last webinar for 2020. We plan to resume our webinar series on Friday, January 8, 2021. We know the governor's January budget will be released around then, so we may need to reschedule our January 8 webinar if it conflicts with the governor's announcement. One thing I'd like to acknowledge before I go further is we know that this is a trying time. We know that in the midst of this surge, that we all are feeling a bit overwhelmed, and that even those of us that have been in the field for years and have weathered things like budget cuts from the last recession, just ongoing things that we've been fighting for years, that even those of us that have been in this for a while are feeling challenged. So I just wanted to pause and just express more than appreciation. I don't know the right word, but it's just we see you, and we acknowledge that this is just it's been overwhelming. So we hope that you can find time to take a deep breath, and carry on. So we thank you. So in thinking back to to our next webinar, I wanted to kind of, in thinking about like the governor's announcement, I wanted to make sure that, I'm sure you all have seen by now that the Sacramento County and many counties, like most counties across California, are under new stay-at-home orders. I know this comes at a time when families are planning holiday gatherings and activities. However, it's important that we continue to do our part to help minimize the spread of the virus. And as we head into the holidays, we acknowledge we won't be on closer to all of the holidays, but I'd like to recognize that last night at sundown commenced the first night of Hanukkah. We hope you and yours have a wonderful holiday season and can enjoy your traditions to the extent possible in a healthy and safe way. And now coming back to the webinar, last week I discussed the master plan, which highlighted some specific statewide plans for the coming years. We are excited about what this means for the Early Learning and Care Division and Early Learning and Care in general in the state of California. But it's important to understand that the master plan is a plan. It's not guidance. It's a plan or a framework in which we will strive to accomplish over the coming years. In a few minutes, I'll go over more on CDE's implementation of the master plan and the next steps. I'd also like to highlight some work happening at CDE as we look beyond the transition to CDSS. Subscribers to the ELCD distribution list should have received an announcement from the Deputy Superintendent of the Opportunity for All branch's email regarding an announcement of an upcoming session inviting stakeholders to partner with CDE to co-create a vision for high-quality preschool, early intervention, and P3 alignment in California. We'll be holding this session on Monday, so this coming Monday, December 14th, from 4:30 to 6. We're excited about the opportunity the Master Plan for Early Learning and Care presents, and we'll be working to focus our resources on elevating the importance of high-quality, inclusive preschool, strong early intervention services, and transitions. We hope you will join us as we move forward together. Before I turn it over to Erica for some opening words, I want you to know kind of reiterating what I said at the top, I want you to know that we at CDE support and understand that you are doing your absolute best to stay open, that you're experiencing unprecedented challenges with distance learning and are concerned about staff and health issues. We want to make sure that you all know that you can go to your regional consultant for case-by-case guidance on any concerns you have about your ability to be open in light of conditions that are beyond your control. And in light of the budget language and the challenges, which again are beyond your control. So we're requesting that you reach out to your program quality implementation office regional consultant for further guidance, for the support and the technical assistance that you need. And on that note, again, we'd like to thank you all for everything that you've done and that you are continuing to do for families and children. As we look forward towards the end of the webinar, we are hoping to have Deputy Superintendent Sarah Neville Morgan join us as we close out our webinar series for 2020. And with that, I would like to turn it over to Erica.
Thank you so much, Steve. You've said it all. Erica Otiono, the Associate Director for the Early Learning and Care Division. We are glad to see that many of you have joined us for this end of year webinar. Happy holidays. We are continually amazed and inspired by some of the things that you have shared about what you do for children and families at this challenging time. For that, we cannot stop telling you how appreciative we are of the work that you continue to do to sustain childcare services for children and families. As I have said before, the year 2020 has been an education in resilience for all of us. We have been resourceful at a level that we've never imagined a year ago. The Program Quality Implementation Office, which has the responsibility to monitor programs, provide support where needed. We have been adapting and have continued to adapt, even under the looming transition to California Department of Social Services. Some of our newly designed processes for training, support, and monitoring, which are designed to be simple, intentional, and workable, they seem to be working. So these will continue into 2021. Guadalupe Romo Zendejas, one of the administrators in Program Quality Implementation Office, will provide you with some updates during the PQI part of this webinar. Stay tuned. We have some more words for you during the closing. I want you all to enjoy this session. It's a special one. Enjoy it. And I'll hand it over now to Virginia.
Thank you so much, Erica and Stephen. So for those of you who don't know me, I'm Virginia Early. I'm the administrator for our policy office in the Early Learning and Care Division at CDE. Again, thanks so much for being here. I feel like Steve and Erica really said everything that I'd like to say, and some of you may have noticed that I actually teared up. I had to wipe my eyes. We really do feel in our hearts a great and deep sense of gratitude for everything that each of you have done each day throughout what has felt like a very long year of constantly needing to be nimble and pivot to address changing legislation, changing executive orders, and all of that. And we'll go into that a little bit more at the end once our deputy superintendent arrives. So I don't have a specific piece to say, during the webinar itself. I'm sure there will be many questions at the end, speaking to guidance that I can address. And so we'll do it that way. But now as the legislature heads back into session, my office will be continuing to work very closely with both the legislature and the administration on the needs of the field. So it's so helpful for us all to know kind of what all of you are experiencing so that we can elevate those concerns and those discussions. So just know that we hear your experiences, and these kinds of conversations that we're able to have with you and others are so critical and heard by us as we engage in those conversations and as the legislature goes back into session. So with that, I'll turn it over to Alana, our moderator.
Good morning, everyone. I am Alana Andrade, and I'm a child development consultant in the policy office here at ELCD. As I'm moderating today, we have our, as usual, the wonderful team behind the scenes answering your questions and making this presentation run smoothly. From the policy office, we have Danielle Davis, Barbara Lindsay, and Eric Dunk. From the PQI office, we have Cassandra Lewis, Crystal Devlin, Brittany Sheffield, Yer Zong, Richard Miller, Katina Boulay, and Serene Yi. Oh, I can hear you typing, Virginia.
Sorry, everyone.
That's okay. It's music to my ears. It just means we're doing good work. And from the Child Development, Nutrition, and Fiscal Services, CDNFS, we have Andrea Johnson, Corey Kahn, and Alan Lynch. From the Child Development Management Information Systems, CDMIS, we have Robert Holm and Carly Netahara. And to answer any questions that you have regarding the food program, we've got Shashi Sharma from the Nutrition Services Division. When we get to the live portion of the Q&A, as well as having the panelists here, we'll also be utilizing all the admins that are here to help answer. Our team is committed to being as responsive as possible. A few kind reminders: please check the frequently asked questions FAQ webpage to see if your question has already been answered. And if you send a question in the Q&A feature, please give us as much information as possible. And now back over to Stephen to review our agenda for today.
Thank you, Alana. So as you heard from Alana, we have a great team on this webinar to address your questions and to help us prepare for today and for each of our webinars. As I reflect for a moment on this team, I love the energy and love they put into this effort. But with this being our last webinar for the calendar year, and while I know how much they love these webinars, I know the team will also enjoy not working until 9 or 10 at night to put the finishing touches on the webinar. Just plain and simple, I love this team. Across the entire division, this team is dedicated to supporting programs day in and day out. As we normally do in today's webinar, you're going to hear about some guidance updates as well as some fiscal updates. As mentioned, I'll be covering CDE's implementation of the master plan, and we'll also be providing updates from our program quality implementation teams, as well as some critical fiscal updates and guidance. After that, we'll review some questions that have come into the ELCD emergency email box. We're going to do our best to address as many questions as we can. You may also use, as Alana mentioned, the Q&A function in Zoom to put your questions into the team. For any questions we don't get to, we will take those back to address in FAQs on our website. So as mentioned in previous webinars, many early learning and care programs are moving from the CDE to CDSS effective July 1, 2021. The CDE is working hard to ensure a smooth transition in order to support the creation of an aligned system of care for infants, toddlers, and other young children. The master plan recommends the transition of early learning and care programs managed by the CDE to the CDSS, which were identified in the 2021 Budget Act. The information again here today again is not guidance. It's rather a blueprint, and there's some things that will require legislative or other executive action. We're just kind of giving an overview of how CDE is both individually and collaboratively working to implement these goals as outlined in the master plan. So last week, I mentioned that the master plan recommends providing California's 3- and 4-year-old children with access to a high-quality preschool experience. To support this, the CDE's role will be to work with programs and engage partners to advance legislation and promulgate regulations to create a new California state preschool program with enhanced program standards and elements that apply to all organizations providing preschool services. The master plan discusses the phase-in of universal preschool for all 4-year-old children, starting with highest needs areas. To support this, this part, CDE will engage partners and oversee the design, development, and implementation of system change, which will include the creation of necessary support to grow and sustain a workforce to support preschool expansion, the adoption of legislation to create the universal preschool program and to promulgate regulations, and the development, the planning and implementation of necessary statutory and regulatory changes to provide a mixed delivery, extended day service for income eligible families who need care beyond core program hours. Additionally, the master plan phase-in access to preschool for all income 3-year-old children, starting with highest need areas. To support this, and in addition to previously described supports, CDE will oversee preschool program design and development, including the engagement of partners to fully design and implement system changes, including structures that encourage non-income eligible families to enroll in preschool by paying fees that may be partially offset with financial incentives, such as tax credits or other offsets, and to sustain implementation and evaluate for potential program improvements. A continuous quality improvement mantra we have. Next, perfect. To ensure the equitable treatment of all children and eliminate bias, the master plan recommends proactively identifying and reporting children's language status and special education program needs. So CDE's roles in this is in coordination with the Department of Social Services. The CDE will oversee legislation requiring programs providing subsidized childcare to identify and report relevant data, regulatory development to ensure collection and use of data, and the development and implementation of professional development, training, and technical assistance. We will share as part of an early childhood data dashboard or other widely shared resource, annual suspension and expulsions disaggregated by race, ethnicity, language, and disability. Another recommendation is requiring specialized training and development to address dual language development, children with disabilities, and how to eliminate bias and inequitable practice in programs. So CDE's role in that is in coordination with CDSS. The CDE will oversee the Title V regulation changes, and for their part, CDSS, the Title 22 regulatory changes, to align and streamline requirements and engage partners to fully design and implement system changes. The master plan also suggests that there be a method of collecting and using data to address issues of equity. CDE's role in this will be in coordination with CDSS. We will oversee legislation, regulatory development, and professional development standards and competencies, and engage partners to inform development and implementation. To support children's learning and development by enhancing educator competencies, incentivizing career pathways, and implementing supportive program standards, the master plan recommends adopting and applying performance measures for the workforce to demonstrate competencies. So for our role in this, in coordination with CDSS in First 5 California, CDE will oversee the system and engage partners to fully design and implement system changes and consider re-engaging the Transforming the Workforce Birth through 8 stewardship group to align with state's previous workforce efforts. At present, that's the information I think we have to share about the master plan. There's a lot of content in it. So if you haven't read it, we encourage you to review it, particularly the areas around preschool and the expansion of universal preschool and supporting the workforce. But at the moment, I will hand off to Roseanne, who will discuss the Family Fee Management Bulletin.
Good morning. Hello, I'm Roseanne Pitts, and I'm an administrator with the PQI office. I'm happy to be here this morning to talk about one of our favorite topics, family fees. This week, we released Management Bulletin 2019A, which provides updated guidance on family fees for fiscal year 2020-2021. We will remind you of the information in the Management Bulletin today and highlight the areas that have been updated. When referring to the Management Bulletin, the new sections have been indicated with updated as the header. This MB was released in response to Senate Bill 820 to provide additional guidance for situations when family fees are waived after September 2020 through June 2021, directives around delinquent family fee plans, and contractor reporting and reimbursement. In July and August of 2020, all family fees were waived for the months of July and August 2020, and contractors were required to issue a refund or credit for all family fees paid during those months. September 2020 through June 2021, Senate Bill 820 does not waive fees for all families. It does waive fees when all children in the family enrolled in subsidized early learning and care programs remain at home, either for distance learning services, when all currently enrolled children are not able to receive in-person services due to a public health order, or for families choosing to shelter in place. In instances where a direct service contractor or provider must close unexpectedly, including a positive COVID-19 case of an employer provider, or are required to limit in-person services in responses to a public health order or guidance, the family's schedule will be reevaluated and that family may be due a refund or credit for a portion of their paid family fees. Contractors will need to determine on a monthly basis whether any credit or refund is necessary to families based on the amount of in-person services that were available when the contractor or provider has closed for some period of time, or the family has not received in-person services due to the COVID-19 restrictions on group size or ratios. If a credit is necessary, the credit should be applied to the month following the determination of a credit or refund. I will just give you a brief example. There are also examples in the Management Bulletin. But if a family is paying a full-time fee and the provider was closed for a period of, let's say, 2 weeks, then when the provider comes back, they need to evaluate how many hours of care that parent was able to access given that the site was closed for that 2-week period. If it's under 130 hours, then the parent would be required to pay a part-time fee rather than a full-time fee. So the provider would provide a credit or a refund of the difference between the full-time fee that they paid and the part-time fee that they were required to pay. If there are no closures during the month, the provider does not close at all, then they do not need to reevaluate any parent fees. The adjustment is only made when the provider closes or care is not available for the family for a period of time. Next slide. The new regulation, so on October 28, 2020, Executive Order 2021-129 was signed by the governor to provide for the transfer of federal funds to reimburse providers for family fees that were waived. In the MB, we provided an update in the authority section to include this executive order. So that's the first place that you're going to find an update in the MB. Pursuant to the directives from the Joint Legislative Budget Committee and the Department of Finance, the California Department of Education was authorized to allocate up to $110 million to augment state subsidized child care contracts for multiple purposes, including the use of $30 million to cover the waived family fees. This funding will help reduce the impact to contractors and providers absorbing fees as previously directed in SB 820, and will be used for other purposes until all funding is exhausted. So now I'm going to turn it over to Corey in the Child Development and Nutrition Fiscal Services Unit for the fiscal update to Management Bulletin 2019A. Corey will be sharing and discussing a lot of information and giving examples. We would encourage you to take notes on the things that Corey is saying, because she has a lot of valuable information to share about the additional family fee updates. Corey?
Yep. Hi, everyone. Thank you, Roseanne. My name is Corey Kahn, and I'm a manager within the Child Development and Nutrition Fiscal Services Unit, which we oftentimes call ourselves or refer to ourselves as CDNFS. And so, as Roseanne said, I'm now going to go over the fiscal components that were in Management Bulletin 20-19A. So contractors will continue to report the waived family fees on the line waived family fees for certified children September through June. However, CDNFS will not reduce a contractor's reimbursement based on the amount reported on this line. So in doing so, contractors will be eligible for reimbursement through the monthly apportionment process. So any amounts due for previous months will be paid in the contractor's next apportionment payment. So this means that all families that have, or all family fees that have been reported to date on the waived family fee lines will be reimbursed to the contractors beginning with the payment that is expected to be received at the end of this month, so at the end of December. This allows contractors to reimburse providers for the family fees that were previously absorbed by the provider, but no longer have to be absorbed due to the additional funding that we received. The alternative payment contractors who collect family fees directly from the family will receive reimbursement through their contract, beginning with the January apportionment to cover the cost of family fee waivers, so until funds are exhausted. And these contractors, the alternative payment contractors who require the provider to collect the family fee directly, must provide reimbursement to the provider in the amount that they would have otherwise collected from the family. So for September, October, and November, where reimbursement to providers was already reduced due to the waived family fees, contractors must provide reimbursement to providers beginning with the provider payment processed in January 2021. Reimbursement to the AP providers for the waived family fees must be made as you're processing the monthly attendance records. So that's beginning January 2021, but as every month as you're processing the attendance records, you'll want to make that adjustment as well for the family fees. The CDE urges contractors, if possible, to make these payments sooner than January, while not affecting the timeliness of the January provider payments for December services. So if you can do it sooner, great. That's what we're urging contractors to do so that the providers have the cash. But January, most of you guys will be receiving January attendance records December attendance records in January. And so that's where you can make the adjustment. So you may wonder how this will look in your day-to-day operations. So the next few slides, I'm going to go over some examples of how the provider should be reimbursed and then how the contractor should report it to the CDE. Okay, So we understand that contractors and providers have agreements that indicate who collects the fee from the family. So in some cases, the contractor collects the fee, and in other cases, the provider collects the fee. In all cases where the family fee is waived, the CDE will provide reimbursement to the contractor to ensure that either they have enough money or the provider, they can then send, provide the funding to the provider for that waived family fee. So I'm going to go over 2 examples of how family fees do not affect the provider's income. In both examples, the provider is typically required to collect the fee from the family. So I'm also going to go over how the contractor will report it on our forms as well. So the first example is when the child is attending in-person care. So in this example, the provider's rate capped at the regional market rate ceiling is $800. The full-time family fee is $40. And so the reimbursement from the contractor to the provider is $760, which is $800 minus the $40 that the provider collected. So the contractor only has to make up the difference of $760. When you add together what the provider received, either from the state or the family fee or the family directly, their total income was $800. So in the next example, the child is sheltering in place and the entire family fee has been waived. So in this example, again, the provider's rate capped at the regional market rate ceiling is $800. Because the family fee of $40 was waived, neither the provider or contractor is going to collect that $40 from the family. So then the reimbursement from the contractor to the provider is $800. So it's the $800 minus any family fees that are collected, which in this case is 0 because the entire family fee is waived. So the contractor is going to reimburse the provider $800. What the contractor will do on the report form is they're going to report the $40 in waived family fees on that waived family fee line from September to June, and then also report $800 in provider payments. And that way the CDE will reimburse the contractor the full $800, which then allows them to in turn reimburse that provider $800. So as you see in both examples, the provider's total income has remained unchanged at $800. So they are still receiving $800. Whether they're collecting it from the family or not, they are still receiving $800. So we also want to address the circumstance where the provider has to temporarily close due to COVID-19, and the family fee is reduced from, say, a full-time fee to a part-time fee. So the only change is that, or in this example, is that the provider's income is fully funded by the state rather than split between the state and the family. So let's go to the next slide to see how it occurs when the provider temporarily closes. So using the example that we went over previously when the child is attending in-person care. So the provider's rate, again, capped at the capped at the regional market rate ceiling is $800. The full-time family fee is $40. And so the reimbursement typically from the contractor is $800 minus $40, which is $760. The provider's total income is $800, which comes from $40 from the family fee or from the family and $760 from the contractor. So in the second part, if the provider closes mid-month due to COVID-19, this is an example. Let's say the family fee, the part-time family fee now drops to $20 for that month. So during the month that the provider closes and the family pays $20, the CDE will pay the contractor the additional $20 needed to maintain the provider's income of $800. So the contractor will report $20 in waived family fees. They'll also report the $800 in provider payments. The CDE will reimburse the contractor $780, which in turn the contractor will reimburse the provider $780. So again, in this example, the provider's total income did not change. It's still $800. What they're getting is $20 additional from the contractor to make it $780. They're still collecting a part-time family fee from the family of $20. So when you add what they receive from the family and the state, their income is still $800. So in all of these examples, you'll see that the provider's income doesn't necessarily change. It's just a matter of who pays for it, right? So hopefully that helped illustrate a little bit how that will work. I think in general, for contractors, anytime or any portion of the fee that was waived, you're going to always report that on the waived family fee line, and then report the total provider payment on the provider payment line of our reports. So now I'm going to hand it over to Lupe, who's going to provide some PQI update.
Thank you, Corey. Happy Friday, everybody. I am Lupe Romo Sendejas, administrator with the Program Quality Implementation Office. I have a few PQI updates for you. First, I want to go over monitoring. So far this fiscal year, PQI consultants have completed 6 federal program monitoring reviews out of the year's schedule of 28. An additional 3 are in progress this week. Our remote contract monitoring reviews and ERRs will begin in January. Agencies that are scheduled for a review this fiscal year should have received notification from their assigned regional consultant. Trainings. PQI has kicked off this year with this year's webinars Wednesdays. The IPERIA training was held on Wednesday this week with 303 in attendance. Next week, on December 16th, we will have a new contractor training. Although this training is targeted to new CDE contractors, you may be interested if you are a new director. Please reach out to your assigned regional consultant for more information on this training or any upcoming trainings. Technical assistance. Agencies who have questions or need assistance may contact their assigned regional consultant for technical assistance at any time. New contractors and contractors who are currently on conditional or provisional status are encouraged to work closely with your regional consultant. The Inclusive Early Education Expansion Program, also known as EAP, it's a grant, is to support the infrastructure to increase access to inclusive early learning and care programs for children with disabilities. $175 million in EAP funding was awarded to 65 local education agencies throughout the state. The ELCD is pleased to announce that we have launched a frequently asked questions webpage for EAP. The website can be found at https://www.cde.ca.gov/FAQs.ASP. Brittany will drop the link in the chat in case you didn't catch that. The webpage includes information regarding the purpose of the grant period, a list of grant recipients, how the funding is being utilized, and other information. The ELCD is finalizing a training resource list to be added to the FAQs, which will provide information on where various professional development opportunities throughout the state may be accessed. We encourage you to access the webpage to learn more about this program. Now back to Corey.
Okay, hello again. So now I'm going to go over some just fiscal updates that don't relate to like the management bulletin, but just funding in general. So the first thing that we're going to talk about is paying providers at the maximum certified hours of care. So the CDE has heard that some contractors throughout the state have exhausted their allocation received for this purpose of paying providers at the maximum authorized hours of care. So as a reminder, contractors received an allocation to reimburse AP providers up to that maximum certified hours of care and included license exempt providers through June 30th, 2021, or until funding was exhausted, whichever was sooner. So funding provided to reimburse providers at the maximum hours of care was required. You were required to track these payments to ensure that the payments to providers didn't exceed the amount of funding that was allocated for this purpose. So contractors were required to consider the difference between paying the providers based on actual hours of care and paying the provider now based on the maximum hours of care. And that's how you would monitor the allocation. So it was really to provide funding for the increased cost of care for paying at that max certified hours and not to cover the entire provider payment for that variable schedule child. So on the next slide, I'm going to go over, I think, an example. So on the next slide, thank you. We also understand that, some contractors may not be able to easily assess the increased costs related to paying providers at the max certified hours of care to predict when they were going to exhaust their allocation and can no longer pay people at the max certificate. So we had presented this example in a previous webinar and discussed this exact example of how a contractor can identify the additional cost of paying a provider at the max certified hours of care for a child enrolled with a variable schedule. And now I'm just going to go over it again today, just because I know that there are many people who are close or have exhausted that pot of funding. So this example, this was an example that determined the additional cost for one child, but the same methodology could be applied if you were able to identify at an aggregate level the total provider payments associated with children enrolled with a variable schedule. So in this example, contractor A has a child who is enrolled with a variable schedule prior to COVID-19, and the contractor typically reimbursed the provider, let's say, an average of $600 per month. Contractor A is trying to assess the additional cost of paying the provider at the max certified hours of care and knows that for the same child, they are now paying $1,000 per month. So the increased costs related to paying the provider at the maximum certified hours of care for this one child is $400. So that is determined by taking the difference between what they are now paying versus what they did pay prior to COVID-19. So the $1,000 minus the $600 is $400. So that $400 is what would be attributed as the increased cost and would be covered by the allocation that they received for this purpose. So contractors who cannot explicitly determine the increased cost and rely on estimating costs in this way for purposes of knowing when their allocation is going to be exhausted should clearly document why they cannot assess the additional costs and have a written methodology on file that clearly outlines how they determined when the funds were exhausted. So we also do realize that each contractor has a different case management system, and identifying and tracking costs or tracking the funding provided for this purpose may not be easy for contractors or as easy as it is for others. So the goal is not to disadvantage these providers who serve variable children versus those who serve children with set schedules. But at the same time, we want to make sure that you, the contractor, does not overspend that portion of the allocation and therefore overspend your MRA, your maximum reimbursable amount, because this wasn't tracked appropriately. So you're going to have to balance those two and really determine when did you run out of that funding, and at that point you stop paying the provider at the maximum certified hours of care, because that money was a specific purpose, and that was given for the increased cost of paying them at the maximum certified hours. So there is a management bulletin, I believe it's 2015A, that discussed this, and it did say until funding was exhausted. So make sure you review that as well. So then moving on to the next slide. So on November 23rd, the CDE released an email to those subscribed to the ELCD distribution list titled Interim Guidance on the Distribution of New Federal Funds to Support State Subsidized Childcare and Updates on Pending Allocations. So included within this communication was a table that informed contractors of the timeframes for pending allocations. So the following allocations have been completed and they have been sent to the CDE's contract office for processing. And as communicated in that email, contractors can expect to receive these amendments by December 18th. So included in the amendment, or these are the ones that have been completed, sorry. So it's family fees waived for July and August 2020 for alternative payment contractors. Family fees waived for July and August 2020 for direct service contractors. Reimbursement for provider payments during COVID-19 related to closures for up to 14 days. And then an allocation to extend emergency childcare enrollments in the California Alternative Payment Program, also known as CAP. So CAP contractors specifically will receive one amendment that could have 3 allocations included. And CAP contractors will receive an email no later than today from their fiscal analyst that provides contractors with a breakdown of the funding that they receive for each purpose. So funding provided for emergency childcare specifically was based on emergency childcare caseload reported on the October 2020 report. What that allocation represents is funding these enrollments through May 31st, 2021. So as specified in the November 23rd communication, the CDE will allocate additional funds in February. And at that time, contractors will be informed as to whether or not the CDE has sufficient funds for emergency childcare enrollments through June 2021. So we're funding through May, and we're hoping that, by February, we'll be able to let everyone know whether we can fund those enrollments through June. So as a reminder, CDNFS has authorized an advance payment to alternative payment contractors equivalent to 3 months of contract costs, and contractors can expect to receive that payment by the end of this month. So we've received questions about what it means to receive an advance payment equivalent to 3 months. So this means that if CDNFS calculated a January payment that equaled, let's say, $1 million, the contractor is now going to receive a payment of $3 million, and that will be received at the end of this month. And so that's where we say it represents 3 months worth of costs. So this advance will ensure that contractors have adequate cash flow to reimburse providers in a timely manner while CDE works to issue contract amendments. The CDE will perform a second round of contract amendments in February, as indicated in the table on the November 23rd email. And during this time, in which the second round of contract amendments are being determined, cash flow for each alternative payment contractor will continue to be monitored, and payments will be adjusted as necessary to ensure that adequate funding to ensure that you have adequate funding to reimburse program expenses and childcare providers. And then so lastly, we understand that some alternative payment contractors will exhaust emergency childcare funding in December. And we do not want the lack of funds to be a cause of disenrollment. So similarly, some contractors have experienced increased costs associated with school-age children requiring full-time care at this time, and we don't want the lack of funds to cause disenrollment on the school-age side. So this advance that we're providing to alternative payment programs, which again is equivalent to 3 months worth of payment, will provide sufficient funds to each contractor to reimburse providers while pending contract amendments are still being processed. So now I'm going to turn it over to Alana, who's going to come back in to facilitate some Q&A if we have time.
You know, Corey, that was all absolutely fantastic and good information, and we appreciate you being the voice today. Okay, so we've got a few family fee questions that I have queued up. I would like to ask either, I would say, Corey or Roseanne to answer this one. So this question is about refunds. So the family fee question, I understand that if the provider closed and then the fees may be refunded to reflect the difference between full-time and part-time fees, but what about if the provider remained open and the child sheltered in place for part of the month? Will the part-time fee apply?
Corey, I'm sorry, Alana, I'll take that.
Great.
The family fee adjustment will only be made if the provider closes or there is no care available for that child because of a smaller group size. If the family chooses to not come the whole month, there will not be adjustments to the family fee. So if they came any part of the month, the fee still stands. If they chose to shelter in place for the entire month, then there would be no family fee, it would be waived. There are, in regulations, there are no credits for absences or illnesses.
Excellent, thank you.
Makes sense.
If there's any more questions, we'll make sure that put it in the Q&A answer box. There's another one about waived fees, and perhaps this is more on the fiscal side. Are the waived family fees reported as part of the total provider payment costs?
Yes. So, and this is the yes is the answer no matter what time of year it is. So even if if the provider is collecting the fee or the contractor is, whether or not it's waived or not, we always on our fiscal report say to report the full provider payment. And that's because what our calculations do is whenever you report family fees that were collected, we subtract that amount from your expenses. So we don't want you to reduce the provider payment when putting it on our form, because that means you're going to essentially be getting a double reduction for that family fee. So that's why we want you to report the entire provider payment, whether it was offset or not.
Excellent, thank you, Corey. We also had a question about Prop 64 money. So I would like to ask Andrea to come up and speak on that a little bit, please.
Yeah, thanks, Alana. So just to give an update on the Prop 64 money, because we are still receiving questions about that. The Prop 64 funds, if you recall, were provided both for alternative payment type contracts, so that's a CAPP type contract, as well as the $50 million provided for expansion funds for the CCTR or general child care type contracts. For the alternative payment type contracts, we haven't discussed that as much because there's been no impact to those contract types, because we did place those funds into contract at the beginning of the year. So they were always part of the total contract amount. So there's been no impact there. With the expansion funds, however, we've addressed that a few times on these webinars,
And we do now have the Prop 64 funds. Those are available to CDE to be able to augment contracts or to create contracts and to pay from those funds. So it's a contract by contract, depending on if the contractor is prepared, has a license, has provided the CDE with all the necessary documentation to be able to create that contract. If all of that is provided to CDE, then we can issue a contract. And we have done so for a handful of contractors now. I think about 10, we've got those expansion funds out. So again, if you are a contractor that received an expansion award, but you do not have the actual contract yet, and if you feel that you should certainly reach out to CDNFS, your fiscal analyst, and your program consultant. But we are in constant communication with all of our contractors with the pending award to make sure that we have all the necessary documents to get those funds out. Thanks, Alana.
Well, thank you, Andrea. And I actually have another one for you. So there was a few questions about hazard pay, and I know that we may not have much of an answer yet, but I ask you to speak a little bit about that, please.
Yeah, we are receiving, I think the question has the questions that I have seen have been specific to the direct service contractors, like our preschool programs, and if that's an allowable cost to the contract, to charge to the contract. So we're going to look into that a bit more because we've seen questions about stipends and hazard pay. So we can definitely do some research on that and get back to you all, or you can also email us directly to get a direct response, but we'll try to get something before our next webinar so we can share more broadly with you all.
Excellent. Thank you, Andrea. So I know that we're running a little bit lower on time, but I hope that you all can bear with us a little bit beyond our allotted time today. And I would like to invite our Deputy Superintendent, Sarah Neville Morgan, to speak.
Thanks so much, Alana. I will try to be brief, knowing that you all have already been on and probably are more interested in FAQs than you are in listening to me. But good morning, everyone. My name is Sarah Neville Morgan. I'm the Deputy Superintendent for the Opportunities for All branch here at the California Department of Education. Thank you so much for joining us today. It's nice to all be together virtually as we close out what has been a very difficult year for us all. Let's hope that 2021 has more bright spots and light after such a hard 2020. You can go with our little hashtag that we use inside our office of 2020 sucks, because this truly, for so many of us, has been a hard year. And I've been watching the FAQs and seeing so much of what's in there, and we agree our teachers and providers are on the front line and doing so much. I just had one of my staff let me know that she had a family member pass away yesterday from COVID. So it's a part of our world and around all of us as we navigate this, as well as a lot of the historic racial injustices that have been brought to light even more due to COVID. So as we wrap up this year at CDE, we really wanted to take a moment and recognize all of you and the incredible work you've been accomplishing in the field. Over the last years, early learning and care contractors and providers, you've gone above and beyond what the normal call of duty to support our children and families are. And you've done this through your parent engagement by providing educational materials and supplies to all enrolled children to minimize the financial burden on families, creating parent support meetings during the typical nap times to check in with parents, making every effort to support each family's home language during distance learning opportunities for students and families who do not feel comfortable with the digital platform, offering asynchronous activities while maintaining open lines of communication with their teacher for support, by even purchasing boots and coats for toddlers and young children so they can play outside. You've also adapted to a technological environment. So you've effectively transitioned from face-to-face to electronic enrollment methods. You've been soliciting funds to purchase laptops and MiFi devices to support preschoolers for your programs where those are needed. You've been supplying families with manipulatives and books, and then demonstrating and supporting them on how to use these during your Zoom check-ins with the children. You've been reading bedtime stories throughout the day. Well, not bedtime maybe throughout the day, but stories throughout the day, and even bedtime ones through Zoom calls. You've successfully been using technology to complete parent conferences. You've offered distance learning through a variety of platforms, and you've held virtual back to school nights and parent educational opportunities via web-based formats. You've also supported supplies and personal protective equipment and been distributing those to programs throughout the counties. You've coordinated other support services, knowing that what we are is not just one element, but truly whole child, whole family. So you've provided meals, breakfast, lunch, and snacks to our distance learners, including picking up produce from free local farmers markets so you can add to the food that's available. You've been creating drive-through parent meetings with handouts that include everything they need for a quick and healthy family dinner. You've worked with organizations to provide play materials for young children, and you've been providing things such as diapers, all these critical supplies. You've also collaborated with public health officials on a level none of us ever thought we would have to, but are definitely needing to during COVID. Coordinating with local resource and referral agencies and other social service agencies in the county to offer mental health and medical services, finance management, and food. We all know a critical part of this pandemic is the isolation and a lot of the mental health components that we all need to connect around to ensure those supports are there. You've been monitoring communication from and interacting with, sometimes as much as weekly, the local public health officials and social service agencies to ensure the health and safety of the staff, the children, and families. And you've adapted to extensive guidance from us at the Department of Education, creating policies and procedures to address new and ever-changing program requirements during the pandemic, sometimes at an extremely quick pace, and responding to new legislation and executive orders as those come down. So those are just a few examples of the countless ways you've helped California's children and families. And we truly, deeply thank you for rising to the challenge and continuing to perform the excellent work you do. I also would be remiss if I didn't thank our Early Learning and Care Division and Child Development Nutrition Fiscal Services team at CDE for all of their continued support to the field. They've been processing the most complex budget we've ever seen, with numerous pieces and additional payments and contract amendments, while they're also engaging in daily meetings and work to address the transition to the California Department of Social Services. A special thanks for our team who creates and holds these webinars as a way to better connect with all of you, our core partners. And a special thanks to Cassandra Lewis, who did the outreach to our contractors that provided me with the information that I could share back with all of you on what you've been doing to successfully support the field. So now I'm going to hand it over to two people who I hold near and dear and look to as I lead and learn, Erica and Stephen, and they'll close out our webinar for 2020. Off to you two. Thank you so much.
Thank you so much, Sarah. That is wonderful, wonderful, wonderful. In closing, I just want to say thank you for your continued efforts to engage and re-engage families. Remember that we're here for you. The PQI consultants, admin, managers, we're all here and available to work together. Lastly, please take care of yourselves. You cannot pour from empty cup. Take some time to rejuvenate. Thank you to all of you, Steve.
Thank you, Erica and Sarah. So as we close out here, just on behalf of the team here at CDE who continue to work to support children, families, and provider professionals, we thank you for taking time out of your morning and spending a little bit more time with us to engage you in this morning's webinar. We hope you'll join us for the next webinar. And we also hope you'll be able to join us on Monday for the launch of the P3 alignment work at CDE. With that, please take care, be safe, be kind to each other, and please take care out there and keep your gatherings small and follow public health orders. We can't do this, we can't do any of this work without you, and we're looking forward to getting back to normal. We will get there together. Thank you, everyone, and we hope to see you in January.